Hey everyone, and welcome back to actually one of my first interviews for 2024. Welcome to the Health IT Playground. And as you guys know, this is my time to educate you about the different careers that are out here in health informatics. Now, we spoke about a lot of different careers, but the one branch that I wanted to kind of touch on right now was nursing, because as you guys know, nurses play a role in informatics. So for your pleasure, for those that are considering nursing, I have the lady for you. Her name is Brianna, and I have her right here with us to talk to us about exactly what she does within nursing, as well as how you can possibly follow her path and potentially be a part of this industry. So I'm going to have her go ahead and introduce herself, and then we're going to go through some questions that hopefully will help anyone here that's watching today. So thank you for joining me, Brianna, and I'll let you just do a quick intro for those that, probably just want to learn more about who you are.
Sure. So first of all, Juliette, thank you for having me. I'm really excited to connect with you and your audience. My name is Brianna, as she stated. I do go by Bri. I am a registered nurse. I've been a nurse now for about 10 years, surprisingly. I don't even know when that happened, but it's happened. um, in addition to my registered nursing license, I also got my case management certification. And most recently, over the last 2 years, got a master's of health sciences with a concentration in informatics. Uh, for the longest time, the major interest of mine was nursing informatics. So a lot of my journey has just been uh, determining how I can use my nursing degree after getting some clinical experience to really transition into this special space. So that's how we connected, and definitely look forward to answering more questions.
Yeah. So thank you for that great introduction. So the question that I always ask everyone on this channel is, how did you learn or even hear about health IT?
I like, I won't say that it's a sad story, but I kind of feel that it's a sad story that I heard about health IT so late in the game. Um, the good thing is that it's never too late to do what you want or to learn something new or to make a change, right?
Right.
But I actually learned about health IT in my last year of nursing. And that was through taking the nursing informatics course. At that time, I didn't really connect nursing informatics and health IT. I still didn't really know that there was a whole health IT space, but I knew that there was a nursing informatics specialty. So, along the lines of trying to understand more about what nursing informatics is and how to get there, was when I started to really learn about health IT in general, and that this nursing informatics specialty really sort of falls into this branch of health IT.
Got you. And for those that may not be fully aware or kind of like, wait, nursing informatics, like how would you define to someone the differences between nursing informatics and all the other specialties out there?
Sure. Um, so nursing, when you say nursing, that can mean anything. There are all kinds of nurses. We have all different specialties. We can fit in several different spaces. Also, when you use the term informatics, you know, that could mean anything. There's public health informatics, there's all kinds of informatics.
Yeah.
So, how would I define what nursing informatics is, and how it's different from other spaces? Well, nursing informatics is really specific to the nursing specialty. So, a doctor is trained to be a physician, they are trained to diagnose and make an assessment. And a nurse is really trained to sort of follow a physician's care plan, but we are also really involved in the day to day activities and nursing care workflow specific to that patient or sets of patients.
Mhm.
So nursing informatics is really about being able to translate what we do in our practice, whether that's, day-to-day activities of truly interacting with that patient,
Yeah.
or even our using our clinical knowledge to support physicians or other interdisciplinary members of a healthcare team. We're taking all of that and trying to improve the technologies that we're using to either serve these patients directly or even to serve the doctors or the interdisciplinary team members to meet the goals of that healthcare system in general. That could be the healthcare system within the hospital setting, the healthcare system within the clinic, the healthcare system within the community, right? So it's that intersection really between us nurses, the rest of the interdisciplinary team,
Mhm.
and then technology.
Gotcha. Got you. And you mentioned that you learned about it during one of your last classes in nursing school. So
Yeah.
how did you then go from hearing and knowing what this is to actually getting and physically transitioning yourself into a job role that was related to that? Like how did you make that transition? Because I know that
Okay.
that's the whole process in itself.
Yeah. That whole process definitely took some time.
Okay.
I try not to necessarily I want to say glorify how easy this transition may be, right? I'll be
Yeah.
candid. It's possible.
Okay.
And if it's something you're really interested in, right? And terms that you hear within informatics piques your interest, it is quite, I would say, generally easy to kind of float your way through different job experiences and positions to ultimately get yourself there. It is probably harder for someone who just wants to get into the space because they don't want to do direct patient care.
Gotcha.
So it did take some time. I worked in a hospital setting for about 2.5 years, not very long, because I knew that I didn't want to be in no hospital. I'm not gonna lie, that's not me. So I left that hospital space
Yeah.
and just started applying to some public health jobs, some just bunches of stuff I threw out there. And I didn't care that it didn't pay as much as, me being in the hospital. I definitely accepted a pay cut applying to a bunch of other sort of healthcare jobs that says a nurse may be good in this role, right? It may have not said nurse, um, but it was still a healthcare supported position.
Okay.
So, how did I make the transition? I landed an opportunity at my local public health department as a TB nurse, or you could just say public health nurse.
Yeah.
So my official title was public health nurse, but I was in the tuberculosis um, department,
Okay.
and that role was set up in similar to a nurse case manager's role. So I
Mm.
had the opportunity to learn about public health, but then also kind of learn about what a nurse case manager does. Because this is me as a fairly recent nurse coming out of a traditional hospital setting and getting a feel for community health in general and then nurse case management itself, right? Even without truly getting that case manager certification yet. Great experience. But it took a pay cut and it took time.
Okay, so it is possible, but what you're saying is that you are gonna have to possibly, if you are currently a nurse and want to transition, there are some changes that you may have to take financially, and just in the type of roles that you're um working towards as you're transitioning into this new area.
Yes. And I would say that specifically for, I guess, newer nurses or nurses with less than 5 years of experience or nurses who actually only have a nursing degree and may not have necessarily been in a IT related field before they decided to do nursing, right? So, yeah.
Okay. And I did want to talk about, because as you know, it is mayhem right now when it comes to finding a job. I don't care what industry you're in. It's ridiculous.
Yeah.
So, what was your experience in the job market, especially, for nursing informatics? How was that experience for you, for those that are currently trying to, get there?
Yeah. Difficult.
I'm sure.
Competitive,
Competitive.
competitive, especially if my resume didn't say anything like, oh yeah, database management or,
Cool.
Excel, SQL. Yeah, like
Yeah.
I don't even know what all that stuff is. So not easy. But the more I sort of in my current role, right? Even in the hospital setting when I was there, the more I tried to participate in like discussions where they wanted to do something different or make a change
Mhm.
or make something better or improve something, the more I did that in my current job, the more I kept like a running log, on my resume
Mhm.
to kind of document how I was a part of those changes and workflows. And so really, I learned over time how to relay those sort of non-clinical skills on
Okay.
my resume better. I got better at being able to verbalize, express, and show on my resume that I had those skills. And once I really solidified how to do that was when the opportunities started to open up.
Okay.
Meaning I at least got a call back. Maybe I didn't get the job, but I got an email inviting me for an interview. That was a really big deal.
Yeah,
And
that is a
when
big.
that started happening, that's when I started to create content. I was like, oh my gosh, this is what should have been doing the whole time. I need everybody to know.
Yes, yes.
Yeah.
And for those that don't know, she does have a YouTube channel. It will be, if check her out, it's gonna
Yeah.
be in the description below, just so you know.
Yeah.
Like content, what? Yes, she has a YouTube channel and we will get there. All right. So as far as what you do, right? So I'm a nurse, I'm watching this video. Okay, cool. She wants to transition. What especially for your first job, what exactly were you doing on a daily basis?
Okay. In my first sort of like healthcare IT related position.
Yeah, like
Sure.
kind of what should they expect to be doing that is so different from just being a nurse?
Yeah, that's a good question. Um, so of course we're talking about nursing informatics, we're talking about health IT, bunches of variations of what this could look like. So I'll zone in on my
Yeah.
specific experience.
Mhm.
Really, first time from direct patient care into more of a health data role. So this was data analysis, I would say.
Okay.
Yeah, it's under that sector. And this was during the pandemic, when all the opportunities opened up for us nurses.
Mhm.
And I worked as a public health liaison. So you could say nurse case manager as well, because this was in a workers' comp setting. This was for a grocery branch, and they wanted to ensure that nurses were managing all their employees that tested positive for COVID, and that people were getting tested if they were exposed to that potentially infectious person during a specific time frame. So there was some case management involved with having a caseload of positive persons and defining who their contacts were. That's called a contact investigation. And just following up with them while they were put, you know, out of the workplace and at home on isolation, making sure that, if they did have other sort of like chronic conditions, that they were being managed by their other healthcare providers, right, outside of just COVID.
Okay.
Sorry, that's the case management piece. I went off on a bit of a tangent. But as far as the health data analytics piece, this involved pulling data from the software system that this company was using to track all these patients.
Okay.
Yeah, so we would go to a select section of the healthcare software to generate reports, and we'd click on the different pieces of data that the boss wanted to see and wanted to know, how many people in the past 2 weeks tested positive in this specific county, and does this specific county need to be notified because we've reached the definition of what is called an outbreak, right? Because the counties and the states are tracking all of these infectious cases, because we just, we want to know, like, is COVID rampant? Is it dying down? That sort of thing. So that first experience was really data analysis, pulling information on cases, being able to report the trends to the team as a whole and also to the boss, so the boss could then report it to all of the people above her as well. Fun stuff. And that was when I first learned about Power BI.
Hmm.
So I really like that. It's such a cool tool. Um, yeah.
Okay. And I see that you have, you know, have a master's, you earned your credentials as a registered nurse. Um, what colleges did you actually attend? And for those that are watching and maybe are like wondering, like, where did she go to learn, and kind of better her skills? Would you recommend these schools from your experience?
Yeah. So I went to an HBCU, historically Black college university. Is that what it stands for? I can't
Yeah.
remember. Okay. um, in um, in Huntsville, Alabama.
Okay.
I went to Oakwood University. I got my nursing degree there.
Okay.
When I learned about nursing informatics, man, it's right when I got out of nursing school. I was like, okay, I need to get into nursing informatics. I'm not trying to be in the hospital. But my first couple of tries didn't work out. Anyhow, I got my master's from Georgia State University.
Okay.
Yeah. And this degree, I would say I do highly recommend it. My teacher was great.
Okay.
Yeah, he was great and really kind of like tailored the lessons towards like my goals and what I was interested in. One thing about this degree, though, it gave me like a general idea of what informatics was, right? This is not a master's of nursing in informatics. This is a master's of health sciences and informatics. So I got a good idea, I would say, of sort of the health IT space,
Yeah, for sure.
and what those different things are, whether that's cybersecurity, database management, data analysis, innovation. And I do appreciate the fact that I got this kind of general broad overview, because I really would not have pieced all that together, to be honest. I guess I can Google, but I wouldn't really know what to Google. So yeah, I think it was still really important to get this degree. It gave me an idea of what I wasn't really interested in. Like, I wouldn't really want to do database administration, but I really do like data analysis, and I like being able to understand that this is what helps us make business decisions, because ultimately, I'm running a business. I want to run a business. So that's really important piece. Um, yeah, I really appreciated the degree for the fact that it gave that really general broad overview. Now, I do wish that there was, like, more specific, like if I decided I really wanted to focus on data analysis,
Mhm.
I do wish that, I got those really true hands-on, in-depth projects to apply in the healthcare setting, to really take that and create a portfolio
Mm,
for next job opportunities. But you know, it was good for the knowledge base and redirecting my thought process.
perfect. I love that. I love that. And thank God for LinkedIn Learning and Udemy's and all these things that could help, you know, kind of gain those additional experiences that, the program may not have provided. So definitely I'm
100%.
sure you were like, yeah, let me do some more stuff here. But yeah, at least you got the
Yes.
foundation, which is
Yes.
priceless, honestly.
Yes.
Now, you have all these great certifications, you have a wealth of knowledge. Are there any professional associations that you're a part of? Are you in, there's so many of them. There's a there's a HEMA, there's HIMSS. I'm sure that there's like nursing informatics stuff that I don't even know about. Which professional associations are you currently a member of?
HIMSS.
HIMSS. Okay, perfect. Okay,
Yeah.
and how do you feel about HIMSS? I know there's a HIMSS versus a HEMA. I hear so some not beef, but there's always a little bit of are you in this or are you in that? So how has your experience been with HIMSS?
Yeah. So I don't really know about past beef or anything like that. Um, I would say that my experience with HIMSS is fairly new. So I joined like last year, and I attended my first HIMSS conference last year as well.
Mm,
I will say I've not really been to like the in-person gatherings, and that is something I would like to do more of. Um, but it's a fairly new experience, and I'm glad that it's something that I'm a part of.
perfect, perfect.
Yeah.
So after all this great information, what advice would you have for someone that is currently maybe been a nurse for the past 8 years, or maybe currently right now in nursing school and like thinking kind of how you kind of learned about it towards the end, they want to jump into nursing informatics. What is your advice to them that they should take to be able to transition into the field?
Yeah. I would definitely say I did not, and I guess I did have access to, but I don't really remember YouTube being such a great university when I was in nursing school. Not for this. Um, I know currently and over the past, I guess, few years, because remember I told you it's been 10 years since I got my nursing degree. So
Yes.
probably over the last few years, I've started to see people like you and other like nurse content creators who are really sharing more information. Um, so something I didn't have access to, and I would encourage nurses to utilize it.
Yeah.
And a lot of us out here, we're saying some of the same things, right?
Yeah.
But you may have said something that just made more sense to me than the other person just because of the way they said it.
Right.
So I like the idea of nurses definitely utilizing YouTube University. Um, I love to journal, so I would say in your nursing experience, right? It doesn't even have to be on your resume. Just your like journal, like maybe your resume journal. Just write down like what are the things that stand out to you when you're on your clinical rotations? Like
Mm,
what makes you feel good inside? Is that directly caring for the patient? Is that, the touching the patient? Is that um, seeing a problem and wanting to fix it? Is it being a part of the conversation with the charge nurse
mhm.
to, decide who gets what? It's like, what is it that you really like? Whether that's the leadership piece, the care coordination piece, the technology piece. If it's the technology piece, what part about it do you like more? Do you like the more super technical talk, or just like, okay, this technology needs to do this better because as a nurse, I want this patient to be able to, I don't know, feel this better or get this done quicker or us complete this quicker as a team. So definitely just write out and journal what are the things that stand out to you. And we have new experiences which change us, things change. And so I think that journaling over the periods of our experiences really gives us a feel for like what we like, how we're growing, you know, where our attention, we're being very self-aware about who we are,
Right.
and we can piece that into where we need to go, and not necessarily like, you know, I just need to get a remote job and work from home, because a remote job too in and of itself is stressful. It may not be stressful because you're directly working with a patient, but at the end of the day, like your computer is still at home.
Yes.
and you still got work to do. You're still on the clock. You still need to meet deadlines. Only difference is you're at a computer doing this all day. So I like the idea of just nurses being more self-aware about what they like, who they are, what's their personality like. Because it definitely took me some time. Like I knew what I wanted and what I liked, but I didn't know where to put it, where to place it. And
Mm,
so far, nursing informatics, healthcare informatics, innovation is exciting to me. So
right. So self-discovery,
yes,
self-discovery and YouTube, well, university, not academy, university. Gotcha.
there you go.
Now, with such a great career thus far, where do you see yourself in 10 years? I want to track you. I like to ask this question. So 10 years
Okay.
past, I can say, wait, like what's going on? So
Uh-oh, holding me accountable.
yes, accountability.
Right. Honestly, in 10 years, I'd love to be running my own nurse recruiting agency,
Okay.
my own boss, and traveling. So yeah, that's where I'm at. And I want to place nurses in unique spaces, right?
Yes.
That are unique to them and their personality. That may not necessarily be nursing informatics, but it's still special to me.
Mhm.
Not just recruiting nurses to recruit them, but to really make good placements for persons and for companies.
Gotcha. Gotcha. Okay. Well, before we close, I like to always give my guests an opportunity to kind of share anything that they're working on. Maybe someone's watching and can benefit. So I know you have a YouTube channel, so I want you to plug that and anything
Okay,
else that you feel that the audience should know about you. And also where can they find you too? Just
sure. So you mentioned my YouTube channel.
yes.
It is girl. I think it's MSHSRN. I believe that is the name of my YouTube channel. And that is my name as well on Instagram. So I'm on Instagram. I'm on LinkedIn. Uh, and my LLC is called We Recruit Solutions. So that is my nurse recruiting agency. And on my YouTube channel, in the near future, I will be creating more content around what building that nurse recruiting agency will look like. And so that will involve, networking, connecting, and maybe even a little bit of a data project. And I think that data project will be fun for people who kind of want to learn what this data project looks like, right? From a nursing perspective, because
Yeah.
we are taught to be very clinical in nursing school. We don't really have that sort of hands-on thing. So it's not going to be anything perfect, but I think it's going to be something fun. We're not going to get super in the nitty-gritty. It's just meant to be very fun and to introduce people to some basic concepts around data analysis. I'll also get to learn more about my audience. So it'll be a collaborative sort of thing. And so this should also help support learning more about my candidates and being able to place them in spaces that are unique to them. So I would hope that, anyone that is watching this who maybe I stated something that is interesting, that they're excited about, whether that's even learning about how to create their own niche recruiting agency or learning about collecting data, whether that's in the healthcare space or just in general. We should connect and follow my YouTube, find me on Instagram or LinkedIn, one of those areas.
Perfect. And I will have all of her information, like I said, in the description below, so you don't have to try to find her here. I will help you out here and put it right below this video. So click on whatever you want to click on, okay, guys? But yes, I do want to thank you so much for your time today, for this great wealth of information. Thank you guys for watching, obviously, and hopefully this has put an end to any questions that you had about nursing informatics. So thank you so much, Bree, for your time. And
Thank
thank
you,
you guys for
Juliette.
watching. Thank you. And see you guys in our next video. Bye.
See you guys.